Hi everyone, we are here to talk about a very important topic, which is COVID-19 and H3N2, which is a variant of influenza virus. How are these interrelated and what is going on with these two terms? We should stay updated. There are still rising COVID cases. About 2 lakh cases has been reported in Delhi itself this year. This is the report of ICMR, that is the Indian Council of Medical Research, which we are talking about. H3N2 cases are much less than that of COVID ones. 500 cases approximately were there till February, and now from March onwards they have reported about 1,000 cases per city, per state. But how are these two interrelated? Why are we talking about two different diseases? One is influenza virus and another one is a SARS-CoV virus. Because in 2011, we all suffered, our nation suffered from swine flu. Swine flu was nothing else but it was a influenza virus variant which was spread due to the pigs, and it transmitted to the humans. And now that variant has turned into a variant called H1N1, and now it's H3N2, because every virus has a quality of mutation, that is a gene mutation. Transferring from one to another, they mutate itself. It's kind of an auto learning process of a virus. But now the cases are rising again. Why is it so? First, after a heavy impact of 2020 and 2021 of COVID, everybody shut down themselves. They learned about how to maintain a personal hygiene and how to deal with if you suffer from the disease. Now this variant is causing the same symptoms like runny nose, fever, nausea, vomiting, etc. There were about 1,000 cases which was reported dead all across the country because of H3N2 and combination with COVID virus. The resultant was severe pneumonia. In my previous video, I had talked about that how does a virus, that is COVID virus, SARS-CoV-1, goes to your body and impacts your embolus, and they forms an embolus, and due to which there are many cardiac arrests reported. Similarly, H3N2 is causing you the flu-like symptoms. These flu-like symptoms, if you don't have immunity, if you don't have nutrition proper, it will adverse you and make you difficult to breathe. And then a combination of both is definitely very much bad for the mortality rate for the India. So let's discuss more about this H3N2, what it is and how does it spread. I have reportedly many cases in Kerala, Tamil Nadu, Maharashtra, Gujarat. These are the states which have suffered from the cases of H3N2 the most. Why is it? Because of the demographics, or because of the living standards, or because of the lack of nutrition? But these are the states which are the most literate states in the country. They have self-sufficient nutrition as well. They don't have to buy the raw materials for food from outside. Why it is happening? Living standards? That is a question which you have to ask yourself. Any flu, any virus is attacked, what the first reaction of the body is, the autoimmune cells, they fight the virus. That is why H1N1 and influenza had a vaccine as well, which was developed, which was given to especially to kids, because pediatric cases were more affected by H1N1 viruses. So there was a vaccine which was developed for H1N1 protection to the kids, infants. And now it's the variant H3N2V. So either, like in every video I say, nutrition is the key and exercise is the key. No matter how much the deadly virus can be. If your immunity, if your body is prevented for that, properly exercised for that, properly deoxygenated, all the deoxidants are all out, antioxidants are consumed, the more you talk about it, the more you know about it, and the more you follow, your body gets more stronger, fitter to fight these viruses. What if you suffer, like for example you have been hospitalized with the virus, what will you do then? First, follow the regime which doctor has suggested. Trust me, the doctor knows their job. They know how to deal with all the symptoms and signs, and the drugs prescribed by them should be taken in the right amount and the right time what the doctor says. At the same time, you have to take care of the dietary and food habits, because these medicines take a definite toll on your body. So nutrition is the key even for digesting those medicines and supplements. Once you're discharged, or you're not, even if you're not hospitalized, once you recover, don't take it like that you just recovered and now you can resume your daily habits again. Take a good leap of 1 to 2 months. Take those nutritional pills what doctors has prescribed. Keep going to your doctor every 15 days to 20 days to consult about the nutrition, to consult about the medications and the health check. Make sure that the viruses H3N2 as well as the COVID has not scarred your lung, has not caused pneumonitis like symptoms in your lungs. If there, then go to a physiotherapist. They will release that cough, that will release their chest congestions by physiotherapy, that is called as chest physiotherapy, via which we make sure that the sputum is released from the lungs, your lung airways are cleared and you can breathe better. Breath is very important. You may be breathing without consciousness that the oxygen is going in and the CO2 is going out. Yes, we all have studied this in the class 1. But the importance of breath is only known when ask the patients who cannot breathe properly. So make sure that you consult your physiotherapist who can tell you about the chest physiotherapy and some home regimes and exercises, as well as the anti-sputum nebulizers and etc., so that the lungs can be cleared, the airways can be cleared, and those WBCs and your autoimmune cells can fight the disease better. If in case you are not infected yet, that's very good and that's very amazing. So please keep your personal hygienes, like the ones which we have taught in the era of COVID. Wash your hands, keep your hands clean, keep your mouth and nose clean. Make sure that the dust particles are all out, and you keep that hygiene level at the best, along with the nutrition and exercises and some meditation, because everybody needs peace. It's not about your physical fitness, it's also about your mental fitness. If you're mentally stressed, if you're mentally ill, every disease will cause you a problem which is not recoverable. So now you know what to do if you're infected with the virus, and if you're yet not infected, so how do you prevent yourself? My advices are well researched. All the data which I give is from the ICMRs or WHO websites or the updated zones where I can get the data and the mutations of the gene. So keep following for more updates. Thank you. Thanks for watching the video. All the data and the details given to you in the video is person specific, professional specific, and is condition based. Nothing is standard. Every variable is different from different people. So before following anything, take it either as a knowledge part, and please go and consult your doctor and a nearest physiotherapist before applying anything on you.